Good afternoon. This is Amol Nirgodkar from Patient Prism. I'm here with one of my closest friends, Rashed
Amol.
from initially from Din Ventures, which is a private equity firm, and now a DSO owner and operator of Maya Dental, an amazing concept in the DSO world. 6 locations right now in Indiana and Illinois, and growing rapidly because of their unique model. So I wanted to not let you go from this conference without talking to us
Thank you.
about. Tell us why your model is this unique. I mean, why are people so excited about joining you?
Thank you very much, Amol. Thanks for having me here.
Absolutely.
Um, I started my dental 2 years ago with the foundation of being a partner to dentists. The DSO space is something that's been in top of mind for a lot of us investors for a long time.
Right.
And for 2 or 3 years, I actually looked actively to buy a DSO.
Right.
But the one thing that was missing for me was the dentists who are working for you day in and day out, and even the staff, they don't really have upside opportunity, nor did they actually have skin in the game either. So I think if there's one thing I've learned in being in dental is it's all about people.
Right.
As a venture investor, we have this concept called product market fit. I think in dental, it's people market fit. You
Very
have to have
nice.
the right people for the right market, and that means both for the patients that you attract. You have to have the right formula for those patients. You have to have the right formula for providing that treatment and the optimal patient care with both staff, providers, everybody. It's all has to be in one sync.
Yeah. I mean, I love the idea of a fit because problems occur when the fit doesn't happen, right?
Absolutely.
When you have the wrong doctor or the wrong team,
Absolutely.
and then the wrong patients, right? Patients usually are not wrong. I mean, their patients are patients. You have to fit your need,
Right.
your services to what they want. But having the doctor engaged, because now you have them not only become partners with you but also share in the upside.
Yeah.
Really, I'm sure it creates a tremendous amount of loyalty, and and I'm sure you see that in increased production as well, because the skin's incredibly tied to the practice.
Our incentives are aligned, right? And again, I started to do this initially because instead of having one or two guys who run the run the group, I'd rather have every single person on board. And when we all do well together financially, eh, the tide rises and everybody, all the boats
All
rise.
the boats are lifted, right? Absolutely.
So that's kind of the model. And so how we work is we buy the practice, the dentists become partners with us, and they usually roll over anywhere from 30 to 40% of the proceeds into
Nice.
our DSO.
Nice.
And we also give we have very creative ways to make it fit their life expectations too. Because everybody is different, right? Everybody has their own.
Not everybody wants to be. Some people just want to do 3 days a week, and
Yeah,
that's what
yeah.
they want.
Yeah.
And so you're kind of customizing it to the needs of the dentist.
Yes.
And some of them just wanna come and practice dentistry and don't want to be in business, and that's okay.
Oh, and some of them actually know a lot more than they have exposure to implement. So that's even so it goes both ways. Like some people don't like managing anymore. That's great. But then other people have actually developed how to manage really well.
Right.
And so that one of the things that's not necessarily unique, but that's a core competence of ours, is everybody's doing something really well. So the ability to bring all of these people together in like a study club kind of format anyway.
Bring
but,
all the ideas.
And so if somebody's doing something really well in one practice, it gives us a great opportunity to bring it in-house and then redistribute to everybody.
It's really fantastic. I mean, so it's kind of a mentorship program within the organization.
Yeah.
To rise the level of everything, the clinical excellence, to
Yep.
marketing, to communication, all of that stuff. I'm really excited. I mean, and you've been always a great friend and a great mentor to many people
Thanks,
in the
Molly.
industry.
You have too.
What do if people are out there looking to affiliate or looking at these decisions, how do they contact you?
Oh, well, the best way probably is email to keep it very simple. Rashed, RASHED, at mayadso.com.
Nice.
MAYADSO. That's probably the easiest way to get a hold of me. But
Absolutely. And I think if you Google Maya Dental or Maya DSO, you're going to see that.
Yes,
See
yes.
all your information there.
Yes.
I encourage you to talk to Rashed because he has incredible insight from both angles, from an investor angle as well as an operator angle. So it's a very unique combination. And I encourage you to reach out and have a conversation about what you want to do. And he's abundant with his advice. So I really appreciate you coming on the show today.
No, thanks, Amal.
I appreciate your friendship.
Such a
Thank
pleasure.
you.
Mine too.
Thank you.
Thanks.